Knock, knock, knock. Can I come in?
Yes.
Hi, my name is India Adams. I'm going to be your nurse today. I am going to do a head to toe assessment on you to document some findings for the doctor. Is that okay?
Yes.
Wash hands. Provide patient with some privacy. May I ask your name, your full name,
Shirley.
date of birth?
05/12/69.
May I check your armband, please?
Sure.
Okay, armband says the same thing. Do you mind if I ask you what is today?
Sunday.
What day is today?
Sunday.
Okay, is it morning, noon, or night?
Night.
Great. Patient is alert, oriented times 3. Speech is clear and articulate for the situation. Posture looks upright. Hygiene is good. Do you mind if I touch your hair right quick?
No problem.
Okay. Do you feel any pain or tenderness?
No.
Great. So, I did not see any bumps, lesions, or scars. Patient noted there was no pain or tenderness, and I did not see any parasites. Next, I am going to ask, could you wiggle your eyebrows for me?
Yes.
Can you smile
Mm-hmm.
and puff your cheeks? Great. So, next, could you close your eyes and let me know where I'm touching?
Yes. Forehead, chin, left cheek, right cheek.
Okay, open your eyes. Cranial nerves 5 for sensation and 7 for movement is intact. Next, I'm going to check your eyes for any redness or discharge. Okay, I didn't see any redness or discharge in the eyes. Follow my pen light for me without moving your head, just your eyes. Okay, and then focus in, out. Great. Cranial nerves 3, 4, 6, and 2 are intact. The pupils were round, reactive to light, and showing accommodation. And 2 for Perla. Next, I am going to ask you to wiggle your tongue. Good job. And then swallow for me. Stick your tongue out. I'm going to check the inside of your mouth. The tongue is midline. Ovula is midline. Teeth are intact. The tongue is red and moist. Mucous membranes are present. I don't see any swollen tonsils. You can close for me.
Mm-hmm.
So cranial nerves 9, 10, and 12 are intact. Next, can I ask you to close your eyes for me?
Mm-hmm.
When you hear the sound in the ears, let me know which ear.
Left ear, right ear.
Good job. Cranial nerve. Okay, next I'm going to check for any serum, discharge, or parasites in the eyes. I don't see any serum or discharge or parasites in that ear. No parasite, serum, or discharge in that ear. Cranial nerve 8 is intact. May I ask you to cover your left nostril?
Yeah.
Breathe in and out. Right nostril. Breathe in and out. Great. Do you feel any pain or blockage?
No.
Good job. I want to check the inside of your nose, ma'am.
Mm-hmm.
The inside of the nose is midline. The nose is kind of moist. I don't see any bumps or lesions. And the nostrils were midline. So nose patency was normal. Next, I'm going to ask you to shrug your shoulders for me. Good job. Push into my hand. Push into my other hand with your face. Great. Cranial nerve 11 is intact. Next, I am going to check all 16 breath sounds. Breathe in and out for me. In and out. In and out. In and out. Lift your shirt up a little bit. In and out. In and out. We're going to go on the other side. In and out. 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 Okay, lift your arm up a little. In and out. We're going to do the other side because we're doing it from side to side. In and out. In and out. In and out. Good job. All 16 lung sounds sound normal. There was no crackling or wheezing. Next, I am going to assess the patient's breathing. Her respiratory is about a 16. Rhythm is regular. Depth is adequate. Her AP to transverse ratio, diameter ratio is 1:2. I don't see any use of accessory muscles while breathing, and no cough present. Next, I'm going to ask you to bend over for me. Spinal alignment is straight. There is no abnormality. Sit up for me. And then breathe in and out for me. Take a deep breath. Her thoracic expansion was equal and symmetric. I'm going to palpate your kidneys for any CVA tenderness. Let me know if you feel any tenderness after I palpate.
Okay.
Any tenderness?
No.
Any tenderness?
No.
There is no CVA tenderness present. Next, I am going to check your corduroy pulses, carotid pulses, one at a time to make sure I don't exclude them. They were a 2+ normal. That is normal finding. Next, I am going to check her lymph nodes. Preocular, behind the ear, postocular, occipital, tonsillar, submental, submandibular, anterior cervical, posterior cervical, shrug shoulders, and supraclavicular. Lymph nodes felt normal. Next, I am going to check your heart sounds. Right side, second sternal border, which is the aortic valve. Left side, second sternal border, which is the pulmonic valve. Third intercostal space, which is the Erb's point, right side. Fourth intercostal space, which is the tricuspid valve. And then fifth intercostal space, right side, which is the mitral valve, and it is the clavicular line, and you can feel the maximum impulse here. Next, I am going to ask, could you lay down for me?
Sure.
Great job. I am going to first auscultate for any vowel sounds. Vowel sounds were of 15 to 20 a minute, which is a normal finding. Next, I'm going to palpate in all four quadrants for any tenderness. Did you feel any tenderness or pain?
No.
Okay, good job. I didn't feel any tenderness or pain as well, or any lumps. I am looking at the stomach. The stomach looks normal to shape. There is no abnormalities, no scars, bumps, or lesions. Next, I am going to feel all four extremities, the arms, hands. I'm going to lift her pants legs up. Okay, skin feels warm in all four extremities. I did not see any bumps, lesions, or scars. I did not see any presence of edema in the arms, hands, legs, ankles, or feet. Next, I want to check for, I'm going to check for capillary refill. It was less than 3 seconds in both hands and arms. That's normal findings. Next, I'm going to ask, when was your last bowel movement?
It was this morning.
Great. Did you have any pain? Was it normal?
It was normal.
Okay, good. When was the last time you urinated?
About an hour ago.
Have you had any frequency all day?
No.
Any pain or odor?
No.
Great job. That was normal. You can sit up.
Okay.
Okay. Next, I am going to check for strength in your extremities. So hold your arms up.
Mm-hmm.
Press against my hands.
Mm-hmm.
Good job. Press against my hands.
Mm-hmm.
Lift your legs up.
Mm-hmm.
Press against my hand.
Mm-hmm.
Press against my hand.
Mm-hmm.
Good job. Other leg.
Mm-hmm.
Press against my hand.
Mm-hmm.
And then press against my hand. Good job. Next, I am going to add, because you're saying all the way up for me. Come around this way. And then walk that way in a straight line. And then walk this way back in a straight line. Feet in a straight line. Good job. You can stop. Turn around towards me. Her gait was normal. There was no wiggling when she walked. Close your eyes. Hands together. Hands by your side, I mean. Feet together. And then stand there for 5 seconds. Close your eyes. She did not wiggle. There was no swaying. You can open your eyes. So Romberg test was a negative. Could you sit back down for me? Next, I'm going to check her range of motion. Do like this for me. Arms down. And then swirl your head. Good job. Lift your legs up, all the way up. Other legs all the way up. And then wiggle your feet. Other feet. Okay, all 4 extremities were equal and symmetric. So that was a good finding. Next, I am going to check her brachial pulses. No, not brachial pulses. I'm sorry. I'm going to check all pulses in all extremities. Hold your arms out. Brachial pulse. Radial pulse. Hold your legs up for me. Put them on the floor. Popliteal. Posterior tibialis. And dorsalis pedis. Next, I'm going to ask you, are you in a comfortable position, ma'am?
Yes.
I'm going to notate all findings to the doctor, and we will be back to talk to you. I want to thank you for your time.
Thank you.
Washing hands and leaving.